So, good afternoon, everybody. I am Dr. Ashish Goel, Director Surgical Oncology.
I am Dr. Abhishek Gulia, Senior Consultant, Radiation Oncology.
So, today we are going to talk to you about cervical lymph node cancer. So, there is a specific situation which we call as metastasis of unknown origin. So, these patients have lymph node enlargement in the neck, but the main problem in this is most of the people think that it is not cancer. They do a needle test and needle FNAC, and they come to the conclusion that it is tuberculosis. So in that case, the disease is missed, and there is a myth in a large number of population that doing a biopsy is not good, it can spread the cancer.
मेरा नाम गजेंद्र सिंह नागर है। मेरे गांव का नाम नौरंगपुर है, जो फार्मूला 1 के पास पड़ता है और काफ़ी सुंदर एरिया है। कुछ दिन पहले एक प्रॉब्लम हुई, मेरे गले में दर्द रहने लगा और साइड में कुछ गांठ उभरी आई। बहुत परेशान हुए, कई हॉस्पिटलों में गए, कई अच्छे डॉक्टरों को दिखाया, पर किसी की समझ में नहीं आया। उसके बाद मैं जेपी हॉस्पिटल में गया। उन्होंने टॉन्सिल का पहले ऑपरेशन किया, ऑपरेशन के बाद पीस लिया और उससे मालूम पड़ा कि गले का कैंसर है। उस कैंसर का फिर हमने ट्रीटमेंट कराया। उसके बाद गले का ऑपरेशन हुआ, तो उसके बाद मालूम पड़ा कि कैंसर 3rd स्टेज का है। फिर उसके बाद ट्रीटमेंट चला। डॉक्टर आशीष गोयल ने सर्जरी किया, सर्जरी बहुत अच्छी रही। उसके 20 दिन बाद डॉक्टर गुलिया ने रेडिएशन दी और कीमोथेरेपी चली। 6 कीमोथेरेपी हुई और 32 रेडिएशन के बाद अब मैं पूरी तरह ठीक हूँ। 2 बार पेट स्कैन में रिपोर्ट नेगेटिव आई है और अब मैं बहुत खुश हूँ।
So, in the case of Mr. Gajendra, initially he presented to us in January 2019 with a PET scan which showed that there were presence of lymph nodes in the neck, and there was no evidence of any primary in the head and neck region. So we had to find out the primary. For finding out the primary, we followed the standard protocol of bilateral tonsillectomy, and we also did a pan endoscopy. By pan endoscopy, we mean we did endoscopies of all these areas, the neck and the pharynx, all these areas. Unfortunately, even after doing the pan endoscopy and tonsillectomy procedures, we were not able to locate the primary. So the case was finally diagnosed as still as a unknown primary and metastatic neck nodes, and he was taken up for surgery.
So this patient, since he had multiple lymph nodes in the neck, we did a modified radical neck dissection in which we removed all the lymph node stations, all the lymph nodes in the neck, preserving the major structures of the neck such as the main vein, the main nerves and the muscle. So complete lymph node dissection was done, and the specimen was sent for histopathology, and histopathology reported as a poorly differentiated carcinoma in several lymph nodes. So many people are fearful of doing a nodal dissection, that it will have problems. So these nodes, since this is the only basin where the disease is there, so this is in fact a curative option. Once you've done the dissection, then the patient was subsequently taken up for radiation and chemotherapy.
Now after surgery, the surprising thing which came up in this case was there were 12 lymph nodes which were positive for metastasis out of the 47 lymph nodes removed. Now that is a huge number, and we had not anticipated that, because in PET scan there were only 2 or 3 nodes which were showing avidity, and we were suspecting around 2 or 3 lymph nodes, but 12 lymph nodes were positive. So that was a huge disease burden, and that too without any known primary. So while giving radiation, we had to take care of covering and giving radiation to all the potential sites of probable origin of the primary. So we did that. We covered the areas. We gave radiation to all the areas which could have thrown these neck nodes, and we also gave concurrent chemotherapy along with that. And thankfully, after 1 year of completion of treatment, now he is absolutely disease free and he is living a good life without any major side effects.
उसके बाद अब मैं पूरी तरह ठीक हूँ। मैं होंडा में जॉब करता हूँ और मैं डेली ऑफिस जा रहा हूँ। 2 महीने हो चुके हैं और अपनी फैमिली के साथ मैं काफ़ी खुश हूँ और अब मैं कैंसर से पूरी तरह